In the United States, tens of millions of children and adults lack adequate access to a fundamental component of wellness: dental health care.
We have the best oral health care delivery system in the world, but it just doesn't reach as far as it needs to.
In North and Northwest Philadelphia, lack of education and poverty merge to deny the care this population desperately needs.
If you had the choice between, spending your afternoon trying to make sure your heat is turned back on or making sure that you can pay your bills, that's going to be a higher priority than your oral health.
Some challenges are cultural. In rural Wetumpka, Oklahoma, many of Bonita Baker's patients are young children raised by relatives, and they're never taught the importance of basic oral health care.
I was raised really poor, and when I see a lot of these kids, I see a lot of myself in these kids. We had a child that came in and had decay in almost every baby tooth, and when I would talk to him and explain to him how important it was to brush his teeth, he said, well, I don't have a toothbrush, I don't have toothpaste, I don't have anything.
The Karuk and other Native American tribes in Siskiyou County, California, face yet another challenge: geography.
Some of these patients live out in areas where there's not even electricity. They may not have running water. Cell phone service is non-existent. The impact of it being very remote on dental care is profound, because those patients that live in some of those outlying areas, they really may not have any way to even get to our clinic.
Open really big for me, like an alligator.
Delivering dental health care to these underserved populations is not a new challenge, but the American Dental Association has a unique new solution: the Community Dental Health Coordinator, or CDHC.
Is this tooth back here that's been giving you the problems?
CDHCs receive 18 months of cross-disciplinary education, then provide oral health services and act as a conduit between those in need of care and the dentists who provide it.
40% of bacteria causes 90% of all disease in the mouth.
It allows folks to go in and do the kind of education and community mapping and outreach that we haven't done before in dentistry. And it's great when there are people that are from the community that the people know, and you give them the skill sets that they need to go into the community where they come from, and then educate, navigate, and bring people in where they could receive the kind of treatment that everybody deserves.
I'm gonna take a look, okay?
Yes, ma'am.
You can open.
Patients are often more comfortable with me as a CDHC rather than a doctor, because they can relate to me more because I'm from the community.
When you gain access to those families and you have ability to educate them and make a little bit of a difference in the field, then those families aren't quite so frightened to come to the clinic and be seen.
Before she pulls the tooth out, we want it to be clear. There shouldn't be any infection in there.
Okay.
The CDHC curriculum is a comprehensive mix of dental and public health education, combining online coursework through Rio Salado College with hands-on clinical training.
They always want to know more. Everybody has to have a passion if you want to be a part of that program, whether as an instructor or as a student.
And has anybody ever showed you how to brush your teeth?
When people don't have healthy teeth, you get this, and nobody smiles. When they feel good about their mouth, you get this. And you see a difference in the overall personality of the patient.
What happens in your mouth affects what happens everywhere else. Beneath everything, beneath all the hardship and the suffering that goes on sometimes in our community, I think that there is truly good underneath all of that. And so if we can work to restore things, if I can be a part of that, then that's great.
I really enjoyed taking the class, and I know it's going to be helpful in the community.
This has been one of the most rewarding professional work experiences I've ever had. Some of our trainees had absolutely no dental experience coming into the program, but they are absolutely high quality, highly skilled oral health professionals now who are proud to have an impact in their community.
I think it's an excellent workforce model. I think it has a tremendous amount of merit and potential, and I think it's something that I hope could and should be adopted and become a new member of the dental workforce team.
Awesome. Good job.